Okay, so have you ever, like, actually stopped and thought about how much pain has impacted your life?
Hmm.
It's something we all experience, right? But what if I told you there might be ways to deal with it, to manage it, I mean, and not just mask it with medications that come with a whole bunch of side effects?
Right.
That's what we're going to dig into today, this whole new world of pain science. And let me tell you, the stuff they're finding out is like totally mind-blowing.
Yeah, no, for sure. It's a really exciting time for pain research, that's for sure.
Yeah.
I mean, for the longest time, it felt like we were stuck with the same old approaches to pain management, but right
Hmm.
now, we're on the edge of like a complete revolution.
It really feels like a whole new era is about to begin, you
That's
know?
right.
And it all kind of starts with this article, right? About this drug. It could be a total game changer. But actually, before we even get to the really sci-fi stuff, and we'll talk about gene editing and all these crazy molecules they're designing. But this article, it does something kind of amazing right from the start.
Oh, yeah.
It brings in this really personal story.
Yeah, it really like grounds you in what it's actually like,
Yep,
living with chronic pain.
exactly. Exactly. So we meet Sarah, and she's dealing with chronic pain, but like really severe chronic pain, to the point where she actually describes it as like having an extra limb.
Wow.
Yeah, it's intense, right? And I don't know, for me, reading her story, it was just like, it was really powerful and kind of heartbreaking too, because you start to realize just how deeply chronic pain affects every single aspect of a person's life, their work, their relationships, their mental health.
Oh, absolutely. It's all connected, right? And the thing is, Sarah's experience, it's sadly not unique. There are millions of people around the world who are living with chronic pain, and so many of them just, they don't have access to treatments that actually work. Or they have to deal with a ton of side effects.
It makes you think about the bigger picture too, like this isn't just about one person suffering. It's families, it's communities, it's entire healthcare systems that are trying to figure out how to help.
It's huge. And the thing is, it even impacts the economy. Think about all the missed work days, the decreased productivity. Chronic pain is something we all kind of share, in a way, this societal challenge. It's
Yeah.
something that affects every single one of us, even if we don't experience it ourselves. And that's a big part of why this research is so incredibly important, because it represents hope for a future with less suffering.
Yeah, definitely. And it underscores just how crucial it is that we discover new and better ways to manage pain. Solutions that actually target the root causes.
Yeah.
Not just Band-Aid fixes.
100%. And to do that, to find those solutions, we first have to really understand what's not working right now.
Okay, so let's talk about that. Let's dive into the limitations of the ways we traditionally think about pain relief, because this article does a great job of laying all of that out for us.
Yeah, so the article kind of breaks down what it calls the old guard of pain relief options, which, I mean, honestly, they haven't really changed a whole lot in like decades, even centuries in some cases.
Really?
Oh, yeah. So we've got your over-the-counter painkillers, things like, acetaminophen, ibuprofen, those kinds of things. Then you've got your NSAIDs. Those are your non-steroidal anti-inflammatory drugs. And then, of course, there are opioids, which, I mean, those are kind of like the heavy hitters when it comes to pain management.
But the thing is, as helpful as those medications can be for some people, a lot of times they come with a whole other set of problems. It's like,
Yeah, it's like you're trying to put out a fire, right? But the only thing you have is this bucket, and it's got all these holes in it.
oh, that's such a good analogy.
So yeah, you might be able to, like, I don't know, maybe dampen the flames a little bit, but the fire's still there, and then you're just left with this big, soggy mess to deal with on top of it all.
That's exactly what it feels like.
Hmm.
And speaking of messy situations, I mean, the opioid crisis is like the perfect example of how these supposed solutions can sometimes actually create even bigger problems.
Oh, absolutely. It's a harsh reminder that we desperately need to find new ways to treat pain, especially chronic pain, and they have to be both safer and more effective. We can't keep going down the same road.
Definitely not. And that's where all this research into this new drug, VX-548, comes in, right? The article called it a potential game changer. And I have to admit, I was very intrigued. So what is it about VX-548 that makes it so different from the painkillers we were just talking about? What makes it so special?
Well, with VX-548, it's like, imagine instead of trying to douse this whole forest fire with that leaky bucket, you could somehow target each individual flame right at its source. That's kind of the idea behind how this drug works. It's completely different from the way opioids or NSAIDs work. VX-548 actually targets pain on like a molecular level by zeroing in on these things called sodium channels, which are in our nerve cells.
Okay, you already know I love it when we get to break down the really complex science stuff.
Right.
So tell me more about these sodium channels, like what are they and why are they so important when it comes to treating pain?
So basically, think of sodium channels like they're these little tiny gateways, right? And their job is to control how these things called sodium ions, they control how those flow in and out of our cells. And these channels, they're like completely crucial for our nerve cells to be able to communicate with each other. And when we're talking about pain specifically, sodium channels are what actually transmit those pain signals, those ouch messages from our bodies up to our brains.
So then if you can block those channels somehow, you could essentially block the pain signal completely before it even reaches the brain, right?
Exactly. You're getting it. But here's what's so ingenious about VX-548. It doesn't just block every single sodium channel. It's way more targeted than that. It specifically goes after a certain type of sodium channel called NaV1.8, which is mostly found in neurons that are responsible for sensing pain.
So it's like having, I don't know, like a key.
Yeah.
That only unlocks one specific door.
Yeah.
It keeps those pain signals from getting through, but doesn't mess with any of the other important nerve functions.
Wow, that's incredible.
It's amazing, right? And this whole targeted approach, it's what makes VX-548 so exciting, because it means it could potentially provide really powerful pain relief, but without all the terrible side effects and that risk of addiction that you get with a lot of traditional painkillers.
Oh, yeah, that's right. I actually wanted to ask you about that because I remember reading in the article that VX-548, in some cases, it was actually shown to be as effective as Vicodin. But how's that even possible if it doesn't carry the same risk of addiction? It kind of blows my mind. Yeah, it's a great question, and the answer really lies in understanding exactly how it works, its mechanism of action. So, see, when you take an opioid, something like Vicodin, for example, it works by binding to these opioid receptors in the brain, which, the thing is, when that happens, it also ends up triggering these feelings of pleasure, right? Which, unfortunately, is what also leads to dependence and addiction. But VX-548, it doesn't even touch the opioid system at all. It completely bypasses it.
It's like, instead of taking that same dangerous road, it's like finding a completely different path to get to the same place, you know?
Perfect analogy, exactly. And because it's so specific in how it targets those pain signals, VX-548 is also much less likely to cause all those other side effects that you often see with opioids and some other types of painkillers. So it really is a totally different approach.
It's amazing. We're talking about potentially groundbreaking stuff here for sure. But I have to ask, how did they even figure all this out? Like, how did researchers even discover this NaV1.8 sodium channel in the first place? And then how did they figure out how to target it so precisely? I mean, this is where the science gets seriously mind-boggling for me.
Oh, it is. So there's this really cool technology. It's called EVIPR that they talk about in the article. And it was actually crucial for this whole discovery. It's basically a high-throughput screening system. Imagine, like, I don't know, what's your favorite food?
Pizza, for sure.
Pizza. Okay, perfect. So imagine you've got this robot chef, right? And it's trying out thousands and thousands of different ingredient combinations, but it's doing it super fast, like lightning speed, to try and find the absolute best pizza recipe ever.
Okay, I can definitely picture that.
All right, so that's kind of similar to how EVIPR works. Scientists can use it to test tons of different molecules all at the same time on these cells that have different types of sodium channels, including NaV1.8.
So it's like this super speedy trial and error process where they can see which molecules actually stick to that NaV1.8 channel and block it. Is that right?
Exactly, you got it. And that's exactly how they were able to find the perfect combination for VX-548. They found the molecule that did exactly what they needed it to do.
It's amazing how far technology has come to be able to do something like that. It kind of makes you wonder what other amazing discoveries are just around the corner, you know?
Yep.
What else scientists will be able to achieve with these new tools?
It's so exciting, right? And believe it or not, VX-548 might be just the beginning. It could be just the tip of the iceberg when it comes to totally new ways to approach pain relief.
I got to say, this article almost had me spitting out my coffee when it started talking about using gene editing for pain relief. Like, am I reading a science fiction novel here or what?
Right. It sounds like something out of a movie, but it's true. That's actually where a lot of pain research is headed these days. The article mentioned this company, Vega Therapeutics, and they are doing some seriously wild stuff with this technology called CRISPR.
I've heard of CRISPR. It can actually edit genes, right? But I'm having trouble wrapping my head around it. How could you even use that for something as complicated as pain?
It's really incredible, actually. Okay, imagine you have this, like, huge set of encyclopedias, right? thousands of pages. And somewhere in there, in one volume, there's this one tiny little typo. But that one typo is causing like a ton of problems. So CRISPR, you can think of it like this magical editing pen that can go in and fix that one specific typo without messing with anything else.
Okay, that's a visual I can get behind.
Yeah.
So then in this case, that tiny typo we're talking about, that's actually a gene that's involved in how we feel pain.
You got it. Naviga, the company we're talking about, they're focusing on this sodium channel called Navi 1.7, which it's kind of like the Navi 1.8 channel we talked about earlier. It's a key player in those pain signals getting sent to the brain.
So instead of trying to block the channel after the fact, once it's already there, this is like going right to the source, right? Like preventing it from even being made in the first place.
That's exactly it. And if it works, the benefits could be huge. I mean, with gene editing, pain relief could become much more personalized. They could tailor it to the individual, and it could potentially even be permanent. Just imagine if you could actually get rid of chronic pain at its source, instead of constantly trying to manage the symptoms.
Wow. That's incredible, but also kind of terrifying, right? I mean, are there concerns about what could happen if we start, like, messing with our genes? What if something goes wrong?
Oh, absolutely. Anytime you're dealing with something as powerful as gene editing, you have to be incredibly careful. It's uncharted territory in a lot of ways. And ethically, there's a lot to consider for sure. And it's important to remember this research is still in its very early stages. Right now, they've only been testing it out in animals.
So it'll be quite a while before we see this kind of treatment being offered to actual patients.
Yeah, it's a long road to get from animal testing to clinical trials in humans, and then even longer to get FDA approval and make it available to the public. But the fact that they're even looking into this possibility, I think it just goes to show how far we've come in understanding how pain works.
Yeah.
And it shows how committed scientists are to finding better ways to treat it. It's really amazing when you think about it.
It's mind-blowing, for sure. We've gone from ancient pain remedies to designer drugs to maybe someday actually being able to rewrite our experience of pain using gene editing. I don't know about you, but my head is spinning.
I do.
So listeners, if you stuck with us this far, I applaud you. We've covered a lot of ground today, but I think it's clear that there's a lot to be hopeful for, even if you're someone who's struggled with pain for a long time.
Definitely. This research, it's a powerful reminder that even though there are still a lot of unanswered questions when it comes to pain, science is making incredible breakthroughs all the time. And with each new discovery, we get a little bit closer to finding safer, more effective, and hopefully even permanent solutions for managing pain. So don't give up hope.
I love that don't give up hope. And on that note, we're going to wrap up this deep dive. We'll keep our eyes peeled for more fascinating developments in the world of pain science, and we'll be back soon with even more insights to share. Thanks for listening.